So good morning. I will call the regular meeting of the Athens County Regional Planning Commission to order for Thursday, November 12th, 2020. We do have a quorum of at least 9 members present, so quorum has been established. Thank you, everybody, for attending this morning. Just an important note for anybody who wishes to speak at this meeting throughout our agenda is that we our government channel for the city that's managing this public meeting has a meeting immediately at 9 a.m. And so this meeting will need to end no later than 9 a.m. So we'll try to keep our meeting as brief as possible. Quorum has been established. So the next item on our agenda is the approval of any minutes from October 8th, 2020. Steve, thank you for sending those out. Yeah. You should have received those minutes in the last couple of days, I believe. I think maybe last night or Tuesday night.
I just got them out yesterday afternoon. I'm sorry about that, but it's been a little hectic here.
I move to accept them.
We have a motion to approve the minutes. Do we have a second?
Second, Lenny.
Second from Lenny. Any further discussion? All members in favor of approving the minutes, say aye.
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 Any opposed? Okay. Minutes are approved. Thank you, Steve. The next item on our agenda is any guests wishing to present this morning. I don't believe we have any presentations on our agenda this morning. And so our next item then would be announcements and updates. Do we have any announcements and updates this morning? Do we have any update or information about the Athens County planner position? Commissioner Schmiel or Eliason? You're on mute, Lenny.
Sorry about that. We haven't done posting yet. We're still evaluating the job description and just working with the contract situation with Bob and Chelsea right now. So it seems to be hanging in there for this time. I think we won't move forward with that till we get our budget done and see what the funds are and how we're going to operate a few positions, because we're looking at combining some duties and some other positions. So it'll probably be after the first of the year before we move anything as far as posting a position.
Thank you, Lenny. Okay, and got a lot on my desktop here. Unless there's any additional announcements and updates, we don't have any new business on this agenda this morning. Does anybody need to make a motion to bring up any new business though? Okay. Any old business this morning? There is no old business on our agenda. So we can move on with our continuing discussions about several items that we've been working on for a while. And again, just a few new people who joined us, please just make note that the meeting has to end at no later than 9 a.m. this morning. Okay, so continuing discussions. The first item is the US 50 corridor sewer expansion project.
We can say we're out to bid. The bids are due in the 24th, I believe it is. So we should have some answers as to whether we get responsive bids by the first part of December.
And Lenny, that would still be construction starting in 2021 then?
Yes.
Okay.
We also got some other funding for the next, or phase 5 as well. So I think we got, what's that, 750,000, I think? Was it for the? Yeah,
there's another 750,000 we got for phase 5.
Yeah, so.
Okay. Is there still fiber getting in this project?
I mean, it's an alternate bid sort of that Chris Cooper with Point Broadband will have to negotiate with the contractors. So that's yet to be determined, but hopefully, yes.
Okay. Okay, unless there's any other discussion on that, we can move to the next item, which is electric aggregation.
I want to announce real quickly that the City of Gallipolis has joined the aggregation program, so that brings our total up to 19 communities in Southeast Ohio.
That's great.
Syracuse didn't pass it.
That is correct. Syracuse did not.
Okay, thanks, Luke. How about the Athens County Land Bank? Any information there? Any updates?
We're working on some ways to use the Workforce Investment Act money to pay for some folks that will help us get work done on properties, including things like cleaning up the trash, mowing the grass, waste diversion, things like that. I know that the FEMA people, we're waiting on this Trimble project that has about 14 properties. And I know that the FEMA process has been very slow, but the FEMA appraisers were down last week and they've completed their appraisal. So those properties will get bid out for demolition soon. And we've got another group of demolitions with a couple in Gloucester, some in Chansey, I think some in Nelsonville that are all going to be coming down in the next couple weeks. So just the continuing process of doing that stuff.
Thanks, Chris. Okay. Somebody have anything else to add there? Okay. Moving on, Athens Township Plains Zoning and Land Use Plan. Looks like that passed last week, if I'm not mistaken. Member Pearson, do you have an update on that from the Township Trustees, Athens Township Trustees?
Right. What we're waiting for now is certification from the Board of Elections on results. Once that is stated, then we have 5 days to get the text and the map recorded at the recorder's office and get a copy to regional planning. I've sent that already, Paul, to you electronically, and I've asked the prosecutor's office if that's sufficient, rather than printing off, 70, 80, 90 sheets of paper and having a map done up. But if the answer is it has to actually be a hard copy, we'll get that all squared away. We'll have to, now the trustees will have to hire an inspector or subcontract that work out. We also have to come up with a list of all the non-conforming uses. We have to set a fee schedule and develop some permit applications. So there's quite a few things here administratively that'll have to be done. The way the statute's set up, even though I'm very familiar with all of this, trustees are not permitted, there's no overlap that's permitted. It's a conflict of interest if we get too involved, if the trustees get too involved. So what I'm hoping is that everyone will be patient as we work to get this up and running. I think some of the things that will happen right off the bat is we'll get a lot of complaints rather than permit applications, because there's a section on public nuisance that was added to the code at the last minute. So that'll be something where it'll take man hours to investigate. There'll be a lot of documentation needed on that, but there'll be no revenue generation out of that. So for right now, everything will have to come out of the general fund. And that's where we're at on that.
Hey, Steve, do you have any digital map of that I can maybe put on the county's website?
Sure do. I can send it on to
or that I can recreate in the GIS, and that way put it out there for that.
Yep. I'll send it to you right after the meeting.
Cool. Thank you.
It would be interesting now that since the Athens Township part of the Plains has passed this, Dover Township trustees had put out the blanket when they denied joining that they would wait to see if it passed or not. Steve, have you heard or have you communicated with them at all now what the reactions are going to be?
No, nope, I haven't talked to anybody over there. So that's something I very easily do, though. See how they react to it, because they did kind of make a statement that they wanted us to take the first shot at it, and then they would consider after that. So yeah, I can make contact with them.
It was a pretty clear vote, if I'm not mistaken.
Yeah, 620 or 40 to
2 to 1, I think. Is that
20 or 40, about 200 votes.
For Steve?
Yeah. No, it wasn't close.
Okay. Next item we can talk about is the Athens County age-friendly initiative. I don't have too much to add on that this morning, other than to say that there's still a lot of movement going on with this. We will be wrapping up getting a survey out towards the end of this month, and beginning to do a lot of planning into 2021. I think there's a few other members on this committee or here right now. I'm not sure if Gary or Jesse or anybody else has anything they'd like to add. If not, we can move on.
Nothing to add for me, Paul.
Okay, thanks, Jesse.
Nothing to add for me.
Okay. We're still looking for volunteers if anybody is interested, I can tell you that. Last item in our continuing discussions, the COVID-19 health emergency. Jack, are you still with us?
Sure am.
Yeah.
Well, I mean, the update is just that we're starting to see massive community spread around the state and around the country, and so we're changing gears in-house to prep for not only vaccine, which appears to be coming sometime in the near future, but also potentially helping stand up field operations for the hospitals if necessary. We've been in contact with the National Guard and seeing what resources they may have available for us. But, the messaging definitely coming out of public health right now is that we need to be more vigilant than we have been to date, because the disease is certainly present in our community and communities at large. So, I have tons that I could talk about, but that's the general umbrella overview.
Is there any way of changing the messaging to where people can get out of this feeling that, oh, it's not bad, you can get it and it won't hurt you?
No, I'll be honest. We've worked very hard at trying to change that message. And I think that we call it COVID fatigue. Americans by nature don't seem to do well with long-term restriction. And so at this point, what we're seeing is that because of that COVID fatigue, people are making choices to spend time with those that they trust, thinking that that's going to be safe. And actually, at this point, that's where we're probably seeing the most spread, is in intimate family and friend settings. And the only way that we've seemed to have any luck in getting people to better understand how significant the disease is if they have a personal experience in some way, shape, or form that's unpleasant. So if that's a friend or a family member who really does get very sick, because again, the vast majority of people tend to manage the disease pretty well. But when you're talking about millions of people being infected at this point, there are certainly many examples of otherwise healthy people getting the disease and not doing well, and there's 250,000 examples of people that have died from the disease. So it's very hard.
Jack, another question. I've heard a rumor through the community that if an older person has been listed as a DNR, that even if they get COVID and that's the real reason that they end up passing, that it doesn't count as a COVID death. Is this true?
That is, well, first of all, unfortunately, I'm not a physician, so we don't have anything to do with the way that deaths are listed on death certificates. That's reserved for physicians and the coroner's office. Generally speaking, I can acknowledge that we've had some disease in a long-term care facility, and there was at least one circumstance that I'm aware of where an individual passed. They were tested as a part of protocol, tested positive, and literally passed within hours of having tested positive. I do think in that particular circumstance, that individual did not get listed as a COVID, it didn't count in the death column when it came to COVID. It wasn't listed as the cause of death on their death certificate. However, in most circumstances, if they test positive for COVID, it is being listed on their death certificate and is being counted. So I don't know if you all noticed, but in the last week, our deaths has doubled from 2 to 4, and that number will change again today because we have some more in the queue that are going to be added to the dashboard today. Circumstantially, there are very specific and isolated incidents where that might be true, but generally speaking, that's not an accurate statement.
Okay. Thanks for addressing that.
Yep.
Jack, I have one last question before we move on, but I'm curious. I know there's a lot in the media right now about vaccines being tested and 90% effectiveness with one, I think, from Pfizer. What kind of a timeline do you expect when vaccines will be readily available at this point?
Yeah, so the optimist in me is hoping for early 2021. I think the realist in me for the general population is probably late spring, early summer before we have widely available vaccine for all people. The study that you're referencing is a Pfizer study. They still are in phase 3, which means that they are, in all likelihood, months away from being able to truly release that for use in the public. There's a mass vaccination plan that's been pushed out by the CDC and modified by the state of Ohio that has basically 3 phases of vaccination built into it. The first phase covers our frontline healthcare workers, our frontline first responders, which would be EMS, fire, and police. And then also it addresses our long-term care facilities. And that will come in waves, and I think it's going to be very slow coming at first. The second phase involves healthcare workers that are not frontline, so that would be like primary care physician offices, those that offer specialty services, public health employees are considered phase 2. Anybody across the board that's immunocompromised that isn't covered in phase 1 might be covered in phase 2. And then phase 3, which is the last phase, is basically the general populace. So that would be, if you are otherwise healthy and under the age of 40, you would probably fall into that category. And realistically, I think that we're probably late spring, early summer before we see anything that's available on that kind of, on the kind of scale that would allow us to get back to a place where we're not hyper obsessing about, social distancing and face coverings. And, I think some of those public health messages will be with us for a while, probably long past next summer. But when you talk about herd immunity, you need to get about 80% to 90% of the population vaccinated before you really made any headway. So our challenge in the short term is convincing people that the vaccine is a valid vaccine, is that it is safe, and that it's going to work. And if you look at some of the polling numbers on the public's opinion or faith in a vaccine right now, it's not real good. So not only are we, pushing the agenda of getting people vaccinated, but in the interim, some of our talking points are going to transition to the process, and that it's going to be a safe vaccine.
Thank you, Jack.
Hey, Jack, I had one question. I get these updates on the Washington Post, and last night I read that there's a guy named Andy Thomas. He's the chief clinical officer at Ohio State Wexner Medical Center in Columbus, and he said that if current trends continue, they're concerned about people who need non-COVID care in Ohio, those who get into car accidents or have heart attacks, and they might not have capacity in the coming weeks, like an emergency rooms. Are you guys getting reports like that?
Yeah, and honestly, that's been the fear from the onset. It is the disease. We're learning more about it, and we're hovering between 2.5% and 5% mortality rates, depending on where you look in the country, and that's a very high mortality rate, generally speaking. Of course, it's not like Ebola, where it's 30 or 40%. But the fear from the onset of the pandemic has always been and continues to be a priority for us, which is the overwhelming of our healthcare system. So absolutely, that's our biggest fear. And again, coming back to the question about people don't think it's a nasty disease, the inherent issue, particularly in rural areas, is that, okay, we acknowledge that it's not a terribly nasty disease, but there is a significant portion of those people that are going to get that are going to need hospitalization and care. And if we have widespread disease, it doesn't take a statistician very long to figure out that means that in rural communities where there may not be a whole lot of hospital beds available, that we run into a problem. So absolutely, that is an issue. I don't know if any of you saw the governor on the television last night or on the radio at 5:30. He echoed that message, and I think that we have and continue to worry about that. I will tell you that Ohio Health feels very prepared. We talk to them on a routine basis nearly every day, and they seem to have a great plan in place. But at some point, just the sheer number will outweigh, their capabilities if the current trends continue where we get into 6,000 and 8,000 positives in the state of Ohio on a daily basis.
Yeah, it caught my eye because it was in Columbus, Ohio, and it was Wexner, which is the Wexner Medical. I guess because of location, that's what caught my attention.
It's a reliable news outlet, and I don't think that those fears are unwarranted. Does that mean they're going to come to fruition? Only time will tell. I mean, but I do think that what public health practitioners and healthcare professionals have been worried about from the onset of the COVID-19 pandemic is that overwhelming of our healthcare system, and we're clearly approaching a place where that is a reality.
Hey, Jack, this is Steve Pearson. The number of beds at O'Bleness is 8, I've heard. Is that correct? 8 beds available?
Yeah. That's a slippery slope, because if you talk to O'Bleness Ohio Health, and Sydney Weber is there, seems to be the lead on their public information. They feel like they will not tell you, and I understand why, that they have 8 beds available, because they evaluate their capacity on a system-wide level. So they feel pretty strongly that if we arrived at a place, and what you're asking is 8 ventilators. So it's okay. That's the question. And they feel strongly that if we arrive at a place in Athens County where we are out of ventilator space, that from a system perspective, they can quickly spin up additional space and vents to accommodate the need. So when you ask them that question directly, and they've been asked that question a lot, what they will say is that we don't like to put a number on available space because we feel like as a system that we can accommodate any of the additional resources that may need to be that we may need to have access to.
Gotcha. Hey, from the governor last night when he spoke, I know you don't have a crystal ball, but it sure sounded like bars, restaurants, and gyms are going to shut down pretty soon.
Yeah, so that's his MO. What he did last night is what we've seen. That's his pattern. I think that last night was a precursor to what is probably inevitable. He did that in July, and then shortly after we had the statewide masking mandate. He did that all spring, where he would sort of waggle his finger and say, you need to get better. And then shortly thereafter, there's an order. I can with some certainty guarantee that if in fact he reevaluates next Thursday, as he indicated, that the numbers aren't going to get better before next Thursday. This isn't a faucet that you can just shut off. So if the statement that he made last night regarding, if it's not better by next Thursday, we're going to seriously have to look at closing bars and restaurants to take out again, I would say that if I was Nostradamus, there's a good likelihood we could be looking at some closures again.
Okay. Another one, a little unrelated, but kind of related. High dose flu vaccine, availability on that?
Yeah, we do have a limited supply of high dose. So for those folks that need it, we have it. Of course, it is in short supply. Shriver's on Union Street, as well as the Athens Pharmacy in the Castrop Center, both also have ready supplies of the high dose vaccine. So I think for folks that really want it, they can get it. We did offer a flu clinic about a week and a half ago, maybe 2 weeks ago. We expected to give a lot more high dose than we did. And so we actually held back about 75 doses of high dose in anticipation of running out at that drive-through clinic, which we didn't. So we currently have a fairly accessible supply. Of course, there are a large number of people who don't want to go into buildings at this point, and I understand that. So we're evaluating running another flu clinic, drive-through style, in order to try to push out the remainder of that vaccine.
Thank you.
Yep.
Jack, is it also true that if you're 65 and older, you automatically get the higher dose?
No, but that's the benchmark. So the benchmark is 65 or older. That's who can receive that vaccine. You do have a choice. It's not a dictatorship down at the health department. So if you really want the other variety, you certainly are able to get that. But we do highly recommend for folks that are 65 years of age and older that they get the high dose vaccine.
Jack, assuming you guys, I have no idea if you guys have the super cooler capacity already for what they're talking about, I think negative 80 degrees for the vaccine storage. Do you guys currently have backup power sources for that, assuming you guys are storing it locally?
Yeah, we do. So an opportunity for me to tip my hat to the city and to the county. They jumped right in early on when this discussion of ultra cold storage came up. We actually now have on-site ultra cold storage, as well as 2 ultra cold shuttles, which will allow us to take the show on the road if we need to. So tip of the cap to the city and the county for financially supporting us and making that decision. We're currently the only health department in the state, as far as I know, that actually has that capacity on site and ready to go. In terms of our backup power, we do have an on-site generator. It is not an industrial grade generator, but it is sufficient, certainly to get us through a week or better if we had to keep all of our vaccine refrigeration operating. That's really is sort of a small investment. We probably house around $250,000 of vaccine at our office. So it's really important that if the power goes out, we've got a way to keep that stuff stored properly.
Keep this in mind, and I'll be reaching out to other communities as well if there's an opportunity through federal funding to improve that resiliency and maybe deploy some renewable assets at the same time. So sounds good though. Yeah.
Jack, thank you on behalf of everybody on this call for all the work that the health department's doing. And it's really fantastic to hear about the coordination between the health department and the county and the hospitals and the city and the university and everybody. It's clear that everybody's on the same page and that the health department knows what they're doing, and your plans that you guys put in place and that you write and all that, we can see that it's you guys are deploying it, and it's having an effect. So thanks, Jack, and to your staff as well.
And to the office holders that got that approval through to get that type of refrigeration storage available. That's
absolutely,
that's foresight, and that's what we need.
Yeah.
Well, you know what's exciting about that is that's a locally manufactured product at our industrial park.
Right.
Sterling Ultra Cold.
Yeah, true.
That's exciting.
We ought to push that across the state that, hey, get down there to Athens to get it.
Yeah, just a quick note on that. Pfizer, their infrastructure is, they're not really built to massively produce those freezers. And we got in early enough that we were able to snag what little limited supply they had available. Pfizer just, I think, put in an order with them in the neighborhood of 5,000 units. So I don't think that, I'm not sure if excessive, I think there's going to be a supply chain problem, a good problem. But I do think that we were really fortunate to get it when we did.
This is Molly Fitzgerald with the EDC, and I just want to echo that, yes, that whenever a business grows rapidly, there's going to be supply chain issues, but we are working with them on expansion plans, both in terms of physical space and supply chain. We've been in conversations with Ohio Southeast as well, and so we're trying to support that company, right here in our backyard, stepping up to the plate when we need them most. So we're doing our best to assist with that growth.
Thanks, Molly. Well, unless there's anything else on that topic, we can move on. Next item would be our planners report for the month. And since unless Lenny or Chris has any update from what Bob Eichenberg's been working on, we can move on to the next item. My understanding from talking to Bob is he's processing permits as they come in, but there hasn't been a lot of activity going on, and he's also working on some grant issues relating to a bike path, if I'm not mistaken.
He's also been allowed to help Chansey with their national flood insurance program a little bit. So
great.
Yeah.
Thanks, Chris. Okay. So moving on to city, village, township, and organizational reports. We can do a roundtable, and I'll call people out as I see them on my screen. Just to remind everybody, we are short on time today. We have until we need to cut the meeting off at a couple minutes before 9 o'clock so that our government channel can get a 9 a.m. meeting set for a city office. So if we can keep it brief, I would really appreciate that. We'll start in my top left, and that would be with the county commissioners. So Lenny and Chris, do you have anything additional to add this morning?
Nothing additional from me.
We approved a couple sub-grants for some CARES money yesterday. One went to the Gathering Place. They are going to get a van. One went to the libraries, Nick Tepe getting iPads and such for seniors. And also one went to the Soil Water Conservation Districts to get some computers so they can work from home. So I'm good besides that.
Thanks, Chris. Next, Scott Frank, City of Nelsonville. Do you have anything to share this morning?
Morning, everyone. Phase 1 of the sewer project's coming to an end. We're wrapping that up as we speak. We're working on phase 3 of that sewer project. We're still in the very early planning stages, which could include expanding sewer into Nelsonville Imperial area. And then we're also working on our water improvements for next summer. So in addition to phase 2 starting next summer for the sewer plant, we're also going to put in half a dozen new water lines and new meters throughout Bookdale and meters within Nelsonville as well. And then the last thing I have is, of course, COVID dependent, but we got a new venue or a new event coming to Nelsonville next September on September 11th. It's the Waylon Wayne. It'll be a big event sponsored by BMW Motorcycles for disabled veterans and kids on the spectrum for teaching them how to ride motorcycles and then take them out onto, out into Wayne National, and then also just some bicycles for the Bailey's Trail.
Great. Thanks, Scott. Mayor Patterson, City of Athens, do you have any updates this morning?
I have several, but I'm going to trim it way down and just mention one thing to everybody. Bring this to your attention, and I would encourage all of you to reach out to the governor, lieutenant governor, or to our state senator or representative, whom I've not heard from in a while. But anyway, it's Senate Bill 365. Senate Bill 365 has the remote meeting rule in it. That will be expiring at the end of this month, which means once it expires, we all have to go back to face-to-face meetings and not be able to meet remotely nor vote remotely anymore. I had an hour-long Zoom meeting with many other people and the governor last Saturday, and it was I certainly conveyed that to the governor and lieutenant governor, who were both on the call. And they were tracking and certainly well aware that they were going to bring it up with the appropriate committee. Again, I just encourage all of you, if you think it's important, with the cases not going down, but they're going up in terms of COVID-19, that each of you reach out to the governor, lieutenant governor, Frank Hoagland, Jay Edwards, and tell them to not let it expire and to extend it well into next year. But if you want to meet face to face and run the risk, then we could do that too. That's all I've got, Paul.
Mayor Guzman in Albany, or Amesville, excuse me. Gary, do you have any updates this morning?
We're just bracing for more COVID. Since March, we had not seen any cases. In the last 2 weeks, we've seen some cases locally. And with cold weather, we're just looking, and the school reopening, we're just trying to figure out strategies to accommodate people and deal with everything safely in terms of the village hall and all the other buildings. So we had all summer with the park available for people to get together. Cold weather is going to put a damper on that. So we're coming up with different strategies, working with the elementary school and others.
Thank you, Gary. And County Engineer Jeff Maiden. Jeff, do you have any items briefly this morning?
No, I really don't have anything today.
Thanks, Jeff. Athens Township, Steve Pearson.
The 56th bridge is reopened, and so traffic is off LaBelle Road. We did an assessment, and we're in the process now of about $20,000 worth of repairs and improvements on the road. We'll send that bill to ODOT and see what they have to say about that. But we experienced about $20,000 worth of damage to LaBelle Road. We've been distributing quite a bit of our CARES funds. We did a sub-grant to the health department for $200,000 to help them set up vaccine stations in the future when that comes up, and to help them with payroll. We also distributed $40,000 to Athens City Schools for a list of things that they'd ask us that they needed. And we're also going to see if we can't use some of that money for the shelter house at the park that's currently under construction. We had huge amounts of organizations having meetings in our open area at the park, and we had a plan to expand with a NatureWorks grant, another shelter house. So we've decided to go ahead with that and see if we can't get that funded with CARES funds also. We have a brand new playground that's going to go in. That's part of the NatureWorks grant, and the basketball court. So we're hoping the weather holds out. We can get all these things in the ground by the end of the year. And that's all I've got.
Thanks, Steve. And Greg Andrews, Waterloo Township trustees.
Yeah, nothing new to report.
Okay, thanks, Greg. Let's see, Athens County Auditor's Office. I see Auditor Thompson and Ben Abfeld both on the line. Either.
Nothing really new to report. We do have one change that second login there under Jill is actually our new real estate manager, Scott Nelson. Just wanted to introduce y'all to them. Heidi is leaving us here in a couple days, moving on to newer, greener pastures, I guess. But I just want to get him on the meetings and familiar with the format, and that's about it.
Okay. Thanks, Ben. Okay. And let's see here. Molly Fitzgerald, Athens County Economic Development Council. Do you have anything to share this morning, Molly?
Now, the only thing I would share, I guess, is that we're exploring these new Jobs Ohio community planning grants, and I know, Paul, you and I have a call about that later, and so I'm looking forward to seeing how we can get some of those dollars in our community.
Okay. Thanks, Molly. Boone Troyer.
Yeah, couple quick things here. So earlier in the meeting, we talked about our need to be vigilant about our response related to the virus. We've already received some things just this morning from the state level tourism offices. We're going to try to really get out in front of this with our communication pieces related to travel. And we have some winter focus plans on health and wellness because we know that a lot of the travel will focus on our Airbnb properties and potentially hotels and kind of taking care of ourselves. With the potential of restaurants and things being closed, our communication plans need to be very forward and direct about that. So we're going to stay, like we said earlier, very vigilant about that communication and focusing on the health and wellness piece as far as our promotions go for the winter.
Thanks, Boone. Luke Selfridge.
No, nothing further pressing at this time.
Okay, thank you, Luke. Well, Jesse Schmeitzer. Jesse, do you have anything this morning?
Just two really quick things. I just received an order with the CARES funding that the mobility program got for about 5,000 reusable cloth masks and also about 60 larger sized hand sanitizer pumps. So if your community needs any, or business or organization, please let me know and I'll get those to you. I'm still able to spend the CARES money on things. So if you need something different than that, please let me know. We'll get it ordered for you. And then secondly, tomorrow is the Athens and City County Transportation meeting. We hold it bi-monthly. So if you need the link for that, please let me know. And that's it for me.
Thank you, Jesse. Tim Warren, York Township. Do you have anything this morning, Tim? You're on mute, Tim. Okay. And Jessica Adine, Athens City Engineer. Jessica, do you have anything this morning?
Thank you, Paul. I just have a couple of updates for continuing design of the West Union project, and so I'll be coordinating with you and the mayor's office to continue review of that. And then the city is continuing work on the sewer improvements needed for the county sewer project.
Thanks, Jessica. And John Katowski. John, do you have anything to share?
I do not. Thank you.
Okay. Thanks for joining us, John.
Mm-hmm.
I'm on here now. As soon as you called my name, I froze.
You're good, Tim. Do you have anything to share this morning, Tim?
No, not really. We're just getting ready for winter, and everything's going well. So we'll find out what happens with all this COVID stuff.
Thanks, Tim. And let's see, the only other person on the call, Lauren Connor. Lauren's my intern. Lauren, do you have anything to share this morning real quick? You're on mute.
Hi, nothing to add today.
Thank you, Lauren. Is there anybody else who needs to speak for the good of the order before we adjourn?
Just one thing, on the possibility of the Johnson Road closure and the intersection closure, there hasn't been anything that I've seen publicly lately. I was wondering if Jeff has heard anything through the state, and I'll keep it as brief as we can to where we can move on, but just that was in the back of my head.
Question, Warren.
Talked to Jamie Hendershot about a month ago about it. And I asked him about, they had committed earlier about actually having a public meeting, but as things have gotten worse, he has also discussed with him the issue with State Route 13 and that entrance onto Route 33 there. That's probably one of the most dangerous. I know we've had a couple of fatalities there. I remember a 17-year-old girl that came through that intersection a few years ago, was broadsided and was killed instantly at that site. So I had real concerns about that, and had some questions about that. The fact that we've got over 2,000 cars a day turning right on Johnson Road to go to Athens. There's more traffic turning right on Johnson Road than there is getting on the ramp at 682 and going south on 33. So you're essentially doubling that. I questioned him about that. And he said that they basically on State Route 13, they can't really close that because the existing exchange at State Route 682, I'm sorry, yeah, that'd be 682, the 680, right near your house there. That interchange can't handle the traffic. So if they close the most dangerous intersection,
to double the traffic.
Yeah, so it's really, I think it's seen as an opportunity to completely close the road. I think they're going to do it.
Hey Jeff, I was in a meeting a couple days ago with Alan Craig from ODOT and group related to the Elm Street project that we have going with TAP funding. And of course, that is tied in also to if Johnson Road is closed off, because that will completely change the way in and out to the high school.
Yeah.
And Mr. Craig didn't let on one bit about what kind of a decision they have or have not made.
Yeah, so, I've really struggled. I've really studied the situation, and I've really struggled with it because since I've been the county engineer, January 2013, there's been two right turn accidents at that intersection, and neither accident, those are particularly dangerous because they're usually high speed, and neither accident resulted in injury. So those were in 2000 and either 14 and 15 or 15 and 16. So we've been over 4 years without any accidents there. And as you look at Route 33 going north, the long-term goal is that Route 33 be a limited access highway with nothing but interchanges. But I don't really see how that's going to happen as you go north there's areas where it's going to be almost impossible if you're going to have any kind of rural access, especially northern Hocking County. But I struggle with it because you have a lot of high school traffic coming out there, and they're young drivers that don't really have the skill to know how to make that right-hand turn and the traffic's a lot faster. I think the biggest dilemma is that traffic coming south is just moving about 10 miles an hour faster than it was 7-8 years ago. And so they've got cameras up, and I've got videos of the accidents that have occurred there on the left-hand turn, and they're just absolutely incredible. I've got 3 of them, and people are pulling up that intersection And literally one lady T-boned a car coming south. It wasn't a matter of being able to, I think it's a lot of it's distracted driving. It wasn't a matter of her not getting across the intersection. She broadsided somebody coming south. How do you do that? And so I think probably what plays heavily in the decision is the fact you got a lot of young drivers there, and improvements could be made to add like a merge lane off of Johnson Road, and also a deceleration lane coming south, more common. But then you have to make that investment. And when the long-term philosophical goal is to create interchange type intersections, then I don't think that's going to happen. So,
when you go north on 33 to Columbus at Canal Winchester, they closed the median off like at the SA gas station there.
Yeah.
So either side of the road, you can turn right, but you can't go across the median. I think that would be the best thing to try to begin with. As a matter of fact, yes. I think they're at the SA when you're headed north to Columbus, they need longer deceleration, and there's no acceleration lane there either.
Yeah, I was at that intersection. I was at that intersection over the weekend, and I had to wait probably 5 minutes. There was so much traffic. I would say the volume of traffic at that intersection is probably 50 times what it is at Johnson Road. But I drive Johnson Road every day. I've been driving it every day since 2006, so I know it very well. I mean, I'm really familiar with it, and I've never had an issue. But I've been driving for more than 30 years, and maybe a few years more than that. But it's going to, Warren, where you live, it's really going to create a problem, because that where your drive comes out right into the middle of that interchange, that entire interchange really needs redone at 682. Yes. And the proper thing to do would be to close that left-hand turn lane and leave that right. We could actually enhance that right turn lane. That deceleration lane can be improved coming south on 33. And I've thought about taking a hard position on that, sending that to ODOT. I could write that letter. I've really struggled with it the last few months, because on the one hand, they tell me, just blame us for it. Don't take a position. But sure as hell, they also told me, Steve Williams told me in 2013, if somebody got killed there, it was my fault. So, you take the responsibility of it. And if there is an accident, if a young high school driver pulls out there and can't get out in time or whatever, and that's a potentially bad accident. So it's a tough situation. The accident data would never support it. The accident data, there's not enough accidents there to even get grant money to do it. Not even close. I mean, we reduced those accidents. The countermeasures I recommended in 2013 actually cut all the left turn accidents out for 4 years. And then in last year, we had 3. So that's what prompted it all. So that's all I got. Any suggestions? I'm certainly willing to listen to any suggestions anybody has on this.
I think closing the median and keeping the right turn only for River Road going north and for Johnson Road going to Athens would be the best solution versus completely closing the whole thing.
I agree. I agree based on just the accident date. I've had traffic engineers look at it.
It will devastate also the businesses there right at the Messenger, Lindley Inn, down, just that whole area, cutting off the access like that, it's not going to be good. And like the tripling up to that intersection by me, it's a mess now. Half the people coming south when they exit onto 682, they don't come to a full stop. And sometimes it's an effort to get out onto 682 from our subdivision which has 40 houses.
No, I know. I used to live there. I know exactly.
Yeah, Warren, I apologize. We need to stop the conversation short just for the sake of getting another meeting set up at 9. I think this is something we should continue to discuss, some of these issues and changes with ODOT, maybe at our December meeting. But I apologize for having to cut that conversation short. Our next meeting date is scheduled for December 10, 2020. With that being said, do we have a motion to adjourn?
So moved.
So moved.